Namaste and hello. You are watching Vibes of India. I am Sakshee Singh. Today we are here at Zydus Hospital to interview a very renowned specialist in diabetes, Dr. V.N. Shah. He is a diabetologist and practicing the same in Zydus Hospital since many years. We all know that diabetes is a common disease among us now. Let us ask the specialist himself that what are the causes and prevention for the same. So how are you today?
I'm fine, thank you, and thank you for your this kind of the information interview. I love the subject diabetes a lot. I'm doing prevention of the diabetes work since last more than 35 years. So somebody is having the interest for the diabetes subject. So I'm thanking for you for your program.
So we all know that we call diabetes as a silent killer. So
Yes.
I want to ask you that why we call diabetes a silent killer.
First and foremost, let me at least introduce why the sugar problem is coming. It is not the disease of the sugar, it is actually disease of the insulin deficiency. And that's why the sugar is coming. We are having three types of the diabetes in the world. Type 1 diabetes, type 2 diabetes, and gestational diabetes during pregnancy, which is coming, that is called the gestational diabetes. Again, why it is a silent killer? Because it is a corrosive effect, just like a udhai dimak jo bolte hain. It is this kind of the effect in our body from the head to toe. Neurology problem, neurology infarction, paralysis, brain hemorrhage, even dental problem, ear hearing problem, heart problem, infarction, bypass, any kind of the heart failure problem, kidney failure, liver failure, and gangrene. All the diseases are byproduct of the uncontrolled diabetes. Even I am telling about the corona call also. During the uncontrolled diabetes, due to the steroid therapy in diabetic patient, plenty of death occur due to this problem. So that's why it is called the silent killer.
So, sir, do you think, like, in my opinion, I think so that this problem is mostly Gujaratis have it like most. Do you also agree to this?
No.
No.
It is not like that because you see where the fatty food is there, where unusual food pattern is there. I'm giving one example. 2018, we were the number one diabetic patient in the world. Now the China is having the number one position, and since last 3 years we are in the second position as far as the diabetic population is concerned. Why the China is first? Because they changed their dietary pattern. They were having the regular food pattern of the Chinese food. We were having our Indian food. But now we are in the fast food fashion. Cold drinks now we are taking. So my slogan is the prevention of the diabetes. For that also, fast food will kill you fast. Again, the cholesterol problem, obesity problem, due to this even NASH, fatty liver problem, and uncontrolled diabetes is a byproduct of our change of the diabetes food pattern. And it is not only in the Gujarat, even South India, Punjabis are having the highest sugar. Even Marwadis also. Every day I am getting 10 to 20 new patient from the Rajasthan in Ahmedabad. Every day. So this is the product of not, it is a epidemic. Now it is a pandemic, just like Corona. Every house is having this problem. So ultimately, it is a product of the unusual dietary pattern, stressful life, smoking, unusual alcohol pattern, and obesity.
True. So diabetes, if taken lightly, can lead to serious complications.
Yes.
And can you please enlighten me about 4 to 5 other diseases that diabetes could actually be the culprit of?
First and foremost, kidney failure.
Kidney failure.
Kidney failure, more than 60% patient, even newly diagnosed, come to our OPD, they are having the kidney problems, beginning of the kidney problems. Anywhere in the world, the cause of the mostly the dialysis is a kidney, uncontrolled diabetes. Paralysis is the second problem. First cause of the blindness anywhere in the world, even developed countries also, blindness is a cause of the uncontrolled diabetes. And similarly, amputation of the limb after accident, the second cause is uncontrolled diabetes.
Only these are the two
These are the all major problems.
major
Even
problems.
myocardial infarction, even heart failure problem, NASH, that is a non-alcoholic fatty liver disease, is a byproduct of the diabetes.
I also wanted to ask you this question that if there is a family and father is diabetic, and so from what age should he start ensuring that his child do not get the diabetes?
It is a very good question, Sakshi. I am always narrating in my second line of the knowledge for this thing. Genetically, we all Indians are prone for the diabetes, first and foremost. We all.
Yes.
Then once your sibling is having, brother or sister is having, then we are having the prone for the 70 to 80% to have the. Once my brother is having, then I am going to have even 70 to 80% possibilities. If my father or mother is having, then my probability of the having the diabetes is 17 to 25%. So it is a definitely hereditary disease, and add-on factor is a lifestyle changes. So that's why it is to be at least checked regularly. Those who are in the very strong family history, stressful life, we are each and every patient observing BMI, that is the body mass index. Our national body mass index criteria is 18 to 23. If it is a more than 24 for 3 to 25 is a overweight, and more than 25 is a obesity. So once you are having the obesity, after 30s you are supposed to check regularly your fasting sugar. If your fasting sugar is a more than 100, then you are a pre-diabetic. 101 to 125 is a pre-diabetic, is the range for the only fasting sugar, which is costing you 30 to 50 rupees of the simple report. And if it is a more than 126, it is a diabetes. So we are again confirmed with the report. We are not stamping out with the all simple report. This is patient is having the diabetes. With that, we are supposed to go with the HbA1c report, and that is the last 90 days average sugar, which we are observing. And the last 90 days HbA1c report, normal is 5.7 below. If it is a between the 5.7 to 6.5 is a pre-diabetic. And if it is a more than 6.5, that is the HbA1c, that is again called the glycosylated hemoglobin, or in America they are telling A1c report. That is the last 90 days average sugar. And if it is a more than 6.5, it is a pakka case of diabetes.
So, Dr. Shah, is there any statistics to prove whether males or females are more susceptible to this?
It is not the susceptibility, but it is again the change of the lifestyle. In the male population, alcoholism is there.
Yes.
Nowadays, even stressful life is there. So, in comparison with the male or female, sometimes percentage-wise ratio is male is with more. That is the thing. So, always I am telling कि change of the lifestyle at home. Once it is there, automatic the prevention will be there. So spend some time with yourself. So out of 24 hours, 1 hour is for our life. That is the 45 minutes walk and 15 to 20 minutes pranayam, yoga, whatever you are having, even breathing exercise. Once you are doing, you will have the at least prevention measure. I am telling you about even repeated pregnancies also, which is going to cause the diabetes. Those who are gestational diabetes, I am telling you regarding this also. Gestational diabetes in our country, it is 14 to 18%. During the pregnancy, diabetes is coming. And it is to be observed at the 22 weeks of the pregnancy. If the sugar is high, then we are supposed to give the insulin therapy in all females of the pregnancy. And
It's
once
safe
that,
during pregnancy.
yeah, 101%, only indication is the insulin, not the oral medication, which is going to give the harm to the kid. Then second thing, once the delivered the baby is there, automatically most of the patients are having the nil sugar level. That's mean normal sugar level. But they are supposed to observe every at least quarterly their sugar level. Out of that pregnancy, during the pregnancy diabetes, they are going for the permanent diabetes. 1/3 of the patient of this pregnancy. 1/3 are having the pre-diabetic level, and 1/3 are having the near normal position. So we are supposed to observe this pregnancy patient also. Post delivery, they are supposed to control their diet and exercise and prevent the permanent diabetes problem.
Even if we do not have diabetes, what to use the right age to start getting diabetic reports done?
I think so after 30s in our country. And here also, some kind of the screening, school screening programs, in colleges also, the health checkup programs for the universities are there. Even you are going to get the license after 16 or 18. Now the government is also asking your sugar level, your blood pressure level, and health checkup. If you are having this problem, this is a primary screening program. Even any job you are applying for, they are definitely asking for the sugar level to see. Are you having the sugar? Any kind of the insurance you are going to cover with, even at the age of the 20 or 30 or 40, they are going to ask your blood pressure report, your cardiogram, and your sugar levels. So from the screening point of view, yes, it is right. But after 30s, those who are having the irregularities in the life, definitely every yearly they are supposed to check only fasting sugar. And if it is the more than 100, at least ask the physician or the diabetologist for the prevention program.
So, doctor, this is the last question for you. If you could share some good health practices to prevent diabetes for our viewers, will be.
I mentioned in between also,
Yes.
fast food will kill you fast. So at least don't go for the fast food, don't go for the colas and drinks, and have our old healthy meal, that is the fruits and salad, that is the raw food material, that is the first dietary habit. Eat less and walk more. So at least have the less calorie values and at least consume the more calorie. Check regularly your sugars level. That is the thing. Those who are having the diabetes, it is called the SMBG, self-monitoring blood glucose. Those who are not having the sugar problem, they are supposed to check after 30 years, every year minimally. Then check your blood pressure is the WHO slogan. That is the must, because you see, whatever the age you are having, you are 25 years old at present. So in 100% out of that, 25% people are having their blood pressure. So this is the frequency of the now the blood pressure also. And regularly I am telling you, all my patient to have the tummy is to be cut down. Greater the waistline, shorter the lifeline. So we are having the सीना चौड़ा होना चाहिए, पेट चौड़ा नहीं होना चाहिए. That is the message always I am. And what is the collection of the fat that is causing the syndrome X? That is the borderline blood sugar, borderline blood pressure, borderline obesity, which is causing the life-threatening problem in the future, I told you about the non-alcoholic fatty liver disease, then the diabetes, high cholesterol value, and in the future, heart attack or the cholesterol high. So this is the lifestyle. So at least change the lifestyle and control your blood pressure, control your sugar, prevent your sugar is the only answer for the prevention of the problem. Any hospital in the world, more than the 50% patients are occupied by the uncontrolled diabetes, in the even ICUs also. So sugar, you rightly mentioned, that's why it is a silent killer.
Thank you so much for your time, sir, and for sharing such wonderful tips with the viewers. Thank you.
So much. Thank you.